Hepatitis among children is on the rise in the U.S. and other countries following a spike in hepatitis C that began several years ago. Dr. Najeeb Zoubi is director of the liver transplant program at Children's Hospital of Michigan Detroit Medical Center. Dr. Zoubi says most childhood hepatitis C is due to adult behavior, especially IV drug use.
Most of the cases of the pediatric hepatitis C happen through what we call vertical transmission from the mothers to the babies.
Screening is the best means of detecting hepatitis C among children. However, if it goes undetected,
they usually would show it, believe it or not, as adults. The disease is a very slow progressing disease, but we can see evidence of it with scar tissue on liver biopsies, elevation in the liver enzyme as soon as 3 or 4 years of age.
Antiviral medicine has been developed only recently, and it's very effective.
With direct-acting antivirals, we call them, and those medications can actually cause cure of the hepatitis C, completely clear it of the patient at a very, very high rate, more than 95%.
The combination of screening and new treatment are a powerful 1-2 punch against hepatitis C, but more cases are being found because of rising opioid abuse. Dr. Zoubi at Children's Hospital of Michigan says the key to the rising childhood caseload is found in the behavior of adults. I'm Dick Hafner for WJR Healthwatch. Childhood hepatitis, severe inflammation of the liver, is on the rise around the world. In the U.S., it's been hepatitis C.
At the time that the child is born, if the mother has hepatitis C, then there's a risk that the mother will transmit the hepatitis C to the baby.
Dr. Najeeb Zoubi, director of the liver transplant program at Children's Hospital of Michigan Detroit Medical Center, says screening is the best way to detect hepatitis C among children.
We focus on the groups that are at a higher risk for transmission. Basically, this is a group of pediatric patients that have mothers with hepatitis C. So we tend to screen those usually by 18 months of age.
What happens then?
There is actually a high rate of spontaneous resolution. A child that is born to a mother with hepatitis C, we prefer not to do the testing right away, but rather wait till after 18 months of age, because there is a chance that they might get rid of it with time. Now, the chance of you getting rid of the virus spontaneously is higher the younger you are.
Undetected into adulthood, liver damage due to hepatitis C can be serious and fatal. The good news, Dr. Zoubi says newly developed medicine can cure nearly all cases if found in time. I'm Dick Hafner for WJR Healthwatch. The opioid crisis has brought with it a spike in hepatitis C among children.
The numbers of mothers that have the hepatitis C has increased because hepatitis C between adults is increased with IV drug use. Then I think that translated into more cases of the pediatric hepatitis C.
Dr. Najeeb Zoubi is director of liver transplants at Children's Hospital of Michigan Detroit Medical Center. Dr. Zoubi says the main weapon against pediatric hepatitis C is screening.
There is no recommendations to screen all the kids. We focus on the groups that are at a higher risk for transmission. This is a group of pediatric patients that have mothers with hepatitis C. We tend to screen those kids by 18 months of age.
Many cases can go undetected.
The liver disease can be silent till all of a sudden the patient will present, for example, with jaundice, which is a yellowish discoloration of the eyes, and then you start investigating, and then you find the liver is already scarred, and even though we have treatment for hepatitis C, but the scarring might be just too much that you might need to do a liver transplantation. So that's why early diagnosis of these cases are very important.
There is no vaccine for hepatitis C, but recently developed medicines are highly effective.
If we find hepatitis C, there is no need to panic because we can treat it before it causes any damage.
I'm Dick Hafner for WJR Healthwatch. More children are getting hepatitis C.
Especially with the opioid epidemic, will affect the kids that are just born to the mothers who have hepatitis C that they got through IV drug abuse, for example.
Dr. Najeeb Zoubi, director of the liver transplant program at Children's Hospital of Michigan Detroit Medical Center, says many children will successfully fight hepatitis C without treatment.
There is actually a high rate of spontaneous resolution, like the virus can go away without any treatment, as high as 25%.
Other cases will go undetected.
All those kids, even though they do not show the symptoms or signs of liver disease, they're going to become adult. They're going to have their own offspring, and they will infect the next generation with hepatitis C. That's why screening becomes very important, but it is also very, very important to try to prevent it from the adult side as well.
Screening is key.
And we are seeing more of the kids that are referred to our liver clinic because of the screening the mothers that just had babies, and screening the mothers have shown hepatitis C, so the patients are referred to us. And the more that you screen, the more cases that you are going to find.
While there is no vaccine, Dr. Zoubi says new antiviral medicines are highly effective for hepatitis C. I'm Dick Hafner for WJR Healthwatch.